I'm Catherine Schuster, and I do pediatric rehabilitation medicine. And I'm very excited to be talking about the role of the rehab team in patients with complex and congenital heart conditions. It's been kind of a new field of patients and a new group of patients that I've been involved with since I've been here. And so it's been really exciting to work with the team here to do what we can to improve the function and quality of life for these patients. So my objectives are to identify the role of a rehabilitation medicine physician in caring for these patients, explore some of the basics of cardiac rehab and the picture of frailty can play a role, and then examine the benefit of the integration of the rehab team with everyone else. So I just want to start with a little bit about what is physical medicine rehabilitation, because it's a field of medicine. It's one of the smallest fields of medicine, and I think it's one that people don't know a lot about or don't have a lot of familiarity with. And so our entire role is to enhance and restore the functional ability and quality of life to those with physical impairments or disabilities, maximizing their independence in activities of daily living, which then improves their quality of life. So in other words, what is the purpose of me being here when we're talking about these patients with complex heart disease and complex medical conditions? And so if you get a whole bunch of rehab physicians together, you're going to have 100 different explanations of what it is that we do. What I tell families is that I'm trying to look at the big picture in terms of what we're doing today and how is that going to impact tomorrow, next week, next month, next year, and what is it that you want to be able to do that is hard or that you can't, and how can we get around that, and how can we think outside the box and work together with all of your other teams to, go back to school or participate in an extracurricular activity or get back on the soccer field or whatever it is, or even feed yourself or tie your shoes. And so it's what is important to the patient and their family, especially as what is impacted by their underlying medical conditions, and how can we figure out together to get around that, to get through that, to overcome that. So that's what I get to do with my day-to-day life. And so people are very familiar with cardiac rehabilitation for adult patients, and there's a lot of literature in terms of what that means and how that improves survival, specifically after heart attacks and the need for complex cardiac interventions like a CABG. So it's been, heavily studied, and it demonstrates lower all-cause readmission. So if you have had some kind of cardiac event and go through a cardiac rehabilitation, it's going to decrease your mortality and decrease your chance of readmission, which is what everyone is hopeful for. Improved cardiovascular parameters then improve all of these other things. So less mortality, less morbidity, improved function, lessened cognitive decline, which is really important as we're talking about truly any patient, but if we can improve that cognitive function so that you can better participate with the world, graduate high school, go to college, get a job, and beyond, is going to be really important. And then less adverse effects to other organ systems and reduced healthcare expenditure. Going through a cardiac rehab program, and this is in an adult, but this is kind of where our thought processes have stemmed from. There's decreased risk of end-stage renal disease, lung disease, cardiovascular events like DVT and PE. And so it's really improving, by improving your heart function, you are then improving all other organ systems and other parameters. So there's 3 phases of cardiac rehabilitation, and it starts in the hospital. And I honestly remember my first experience with this when I was an intern rotating on the post-CABG unit, and just the discussions that they were having about how to integrate those rehabilitation strategies for these patients. And so this is a very well-defined stage of rehabilitation, with the first stage starting in the hospital, the second stage being the supervised stage with cardiac rehab. And that the stage 2 of cardiac rehab is what everyone thinks about when you say cardiac rehab. And this is where you're going to those cardiac rehab gyms. There's some kind of monitoring oversight. Very frequently there's a physician there, maybe not necessarily on site, but very closely affiliated. But the parameters are monitored. And then stage 3 is maintenance. So it's just doing all of those things to maintain your physical fitness. And so cardiac rehabilitation, as kind of we all think about it, is how the PM&R team really got involved with the Norton Children's heart failure team, because I had people calling me and saying, hey, I have this kid who had XYZ, cardiac related, and we need cardiac rehab, but no outpatient place will take them. And so that is where we got involved, because how can we help these patients where we know cardiac rehab is beneficial for adults? The literature is very large, comparatively speaking. There's no literature in PM&R is very large, but within PM&R, cardiac rehab has a lot of supportive evidence. But what can we do? How can we help support these patients who they either have this complex cardiac condition that is being medically managed, or they've gone through extensive surgeries, but things just aren't as good as we would like them to be. So what can we do? So that's how our team got involved. And so we took the literature that exists and tried to extrapolate it as much as possible for these pediatric patients to support them to improve what I care about every day of my life, is their function and quality of life. So we know that cardiac rehab improves exercise tolerance, decreases symptom burden, increases your lipids. Smoking reduction is a huge part of cardiac rehab, which hopefully is not a big component of the pediatric cardiac rehabilitation needs, but sometimes in Kentucky, you never know. Improvement in psychosocial well-being and stress reduction, and then reduction in mortality, and it's safe. And so the chance of an adverse event in someone undergoing cardiac rehab is incredibly low. And so that's really important, for these patients have gone through something tremendous, and we don't want more problems, right? We don't want what we're doing to improve their function and quality of life to cause more issues. And so cardiac rehab is very safe. So then looking at all of this, there's the syndrome of frailty, which comes out of a lot of geriatric literature, but it's been applied to multiple conditions in the adult world and is slowly trickling down into the pediatric world. So frailty is a syndrome of decreased reserve and resistance to stressors that leads to increased vulnerability to adverse outcomes and impaired physical function and activity. And there are a couple of different ways to define it, but one of the easiest is the frailty phenotype as defined by Freed, which is low lean muscle mass. And so that is an unintentional weight loss of 10 pounds in the past year, self-reported exhaustion, which is by answering the questions, I feel that everything I did was effort, or I could not get going. Low energy expenditure, and so that's just you're not burning as many calories because you're not doing very much. Slowness, and that's measured by the 6-minute walk test. And then weakness, which is hand grip strength stratified by age and body mass index. And so the phenotype is very, it's created for adults. And so a 10-pound weight loss in a 2-year-old is not necessarily possible, and something, it's really hard to measure this for pediatric patients. And so we've been trying to take some of these things that address frailty and extrapolate them into the pediatric population, because frailty, which is you answer yes to 3 of these 5 things, leads to increased morbidity and mortality as it relates to cardiac indices, increased risk of heart failure, and for example. And so there's not direct correlates within what it exists for adults to extrapolate it to pediatrics, but we've been trying to do that to demonstrate that it's important to look at all of these other metrics within a pediatric patient with complex congenital heart disease or acquired heart disease, so that we can intervene either before they undergo a surgery or after, knowing that we want to improve their function and quality of life also. So there's this cycle of frailty, which is how all of these things are related together. So weight loss decreases your muscle mass, decreases your metabolic rate, decreases your strength, decreases your walking speed, decreases your activity tolerance. If you're weaker, you have impaired balance, you're more immobile, you're more prone to fall. So like everything is all interconnected. But what's super important for me is at the bottom of this all leads to dependency and disability and dependency, which is what we want to avoid. We want these patients who have been through this major event, and we've spent a lot of time and energy and resources getting them ready and talking with the families, but we want them to be able to continue to recover and thrive as it relates to their entire function and quality of life. And so the role of rehabilitation has really kind of grown over the past couple of years. There have been a lot more literature, papers, people commenting about frailty in pediatric populations, not just congenital complex heart disease, but across pediatric cancers and other like solid organ transplants. So people are starting to recognize the importance of frailty extrapolated across the spectrum of diseases and ages. And recently, the American Heart Association, when they redid their new guidelines for cardiopulmonary arrest, rehabilitation has now been included in those guidelines. So rehabilitation has been demonstrated on the short term to improve general cardiovascular and mental health. They have shown repeatedly that there's a low risk of any kind of clinical deterioration or sudden death during an exercise program that is done in an appropriately monitored and standardized way. And then the American Heart Association, so this is taken directly from their new guidelines. And so you have ROSC, and then when you're talking about disposition, the disposition, rehabilitation is mentioned in that. And so that's a really important component because this traumatic thing, you had a cardiopulmonary arrest and you've survived. And so now what? And how are we going to continue to improve your quality of life in the setting of having this large event? And so what is really, I think for me, what I think about when I'm dealing with patients, any patient, but as it pertains today to cardiac patients. So after cardiac arrests, parents have reported worse role functioning. So the child is having a harder time integrating within the family unit. There's a worse general perception of health. So they just feel like I'm not healthy. Things are not good. There's a worse impact on parental health. And so parents are giving up their health needs to take care of the needs of their child. However, there is a higher family cohesion in terms of reported in terms of everyone is rallying around the patient to make sure that their needs are met. But as you can see, worse parental health impact, that's to the detriment of the other members of the family. And then after congenital heart disease, it's been noted that patients will have lower processing speed, lower mathematical achievements, difficulties with attention and visuospatial ability, and then both the patient and the parents will report decreased quality of life. And so the role of the rehab team is really to intervene across all of those things. So knowing that these things can happen, knowing that there is a chance that knowing that there's a chance that this is going to impact both the patient and the family, and how to intervene if we can before a complex cardiac surgical event, if we know about it, or after, because obviously you can't always predict when these things are going to happen, specifically looking at the known domains of challenge, and then integrating with the child's school, with their counselors, with their support systems, to make sure that we are addressing all of their needs, so that they can, what do you want to do next week, next month, next year, and how can we promote that? So that is, I could talk about this all day long, and this was incredibly short because there are a lot of there's not a lot of data out there that really addresses this directly, but it really just highlights for me all of the things that I'm trying to capture for my patients, which is thank you for unsharing my screen. I'm so terrible at all of this technology thing. You would think that I'd be so much better after 3 years, and I'm still terrible. But I want to integrate with the teams in a way that everyone is doing the very best that they can for every patient in every situation, but thinking about how is this going to impact today, tomorrow, next week, next month, next year. And so that's one of the things that I love so much about being a rehab doctor, is I get these relationships with my families and get to celebrate these successes in situations where sometimes they feel like, no, I've never been able to talk about what if I graduate from high school, because the cardiac teams and everyone else has gotten us to this point, and now we're having these conversations about I get to have these what ifs. And so working with patients and families in terms of strengths and weaknesses, and I mean literal and figurative strengths and weaknesses. And so how can we get around those so that we can do whatever it is that they want to do. I have one young man, he really wants to be a basketball coach. And so we've broken down what are all the components of being a successful coach. And so, it's all of the cognitive abilities, but then it's, walking up and down the court or having your voice that's loud enough to be heard in the face of screaming fans. And so how to improve upon all of those things for him has been a really enjoyable experience, but also like really highlights the role of the rehab team in this situation, because now we're able to have those conversations. So that's all that I really wanted to say. And I'm really thankful that you guys gave me an opportunity to talk with you guys today.
Thank you so much, Catherine. I had a couple of questions, or one question, especially for the general pediatricians on the call too. I think, if we start to notice, I take care of patients who have heart failure or heart transplants. And so if we start to notice patients as an outpatient, because, originally in your talk, you talked about sort of the inpatient referral process and kind of down that road. But if we start to notice changes in patients who, from an outpatient perspective, what are your role in that process, and how can pediatricians kind of get kids to you, or can they, or how does that work?
So certainly I'm willing to see any patient that anyone feels like needs rehab. And I kind of joke, like everyone needs a little bit of rehab in their lives. In terms of outpatient, so I actually have a number of patients that I just follow yearly to make sure that their goals are being kept in mind. And as these kiddos get older, that they are part of those conversations. And so for older teenagers, there are a lot of standardized tests that can be done to truly monitor your progress. Like, so the 6-minute walk test I mentioned at the beginning, and the grip strength. So those are two very common parameters that have age norms down to 6, I believe. And so that's a simple way that any physical or occupational therapist can run those types of tests to have objective data to make sure that we truly aren't losing function. And then in the setting of needing ongoing rehab services with the physiatrist as the physician leader of that particular team, and then directing that into physical therapy, occupational therapy, speech therapy, and then neuropsych testing and those domains to make sure that we are doing, we're working together to not lose function. And then is there an area of significant concern that we need to investigate further? And we've done that before, like we all work in that way. So. But yes, we have inpatient at Fraser, which is our inpatient rehab, and then we also have clinic. And so we can see patients in any setting, as well as in the hospital, obviously.
And you had mentioned, the 6-minute walk test and grip strength and stuff. Is there anything else that, from your point of view, that should be a trigger warning for providers to think that, okay, like I feel like I'm missing something, or I feel like patients are changing, in terms of trying to notice things and be proactive early?
So I think the biggest thing for me would be, as you're asking the patient and talking to the families. So things that I think are big triggers are where kids are self-selecting away from activities, and it might not even seem intentional. Like they used to be really into doing XYZ, and then all of a sudden they're like, I don't think I'm going to play that this year. And so they're oftentimes subconsciously moving away from things that they used to previously enjoy. And then that puts a light bulb for me, like, is there something going on that's keeping you from physically, cognitively, emotionally from being able to do that? Because then I think that warrants an investigation. And then kind of in a more obvious sense where, they can't walk around the grocery store with me anymore. Like those things I think are a lot more obvious. Or now it's taking them, 10 minutes to get dressed when they used to be able to get everything together in 3 or whatever. So it's those kind of minor details that I think warrant more thought processes in the setting of a known cardiac condition. So that decline or that change that sometimes can be seen as subtle, but in this patient population, I would think about it a little bit more and ask more questions and investigate. But that self-selecting for me, I think, is a big one. I've come across that quite a number of times within our shared patients.
Yeah, for sure. I feel like we've seen that a bunch. I don't see any other questions or anything in the chat. Thank you so much. The talk was great. I really appreciate that.
Thank you. I really appreciate the time to talk with everyone, and I'm always available if you guys need me.